coming to you from the studios of NABN TV, Doctors in the House. Today, I will be your host as we discuss a very important topic that's shocking the world. A massive cholera outbreak is occurring in Cameroon as we speak. On Friday, March the 25th, the Cameroon health minister announced that 29 people have died of cholera in Cameroon in the past week. According to the Center for Disease Control and Prevention, Sub-Saharan Africa has the highest number of cholera cases and deaths each year. In the CDC's view, the situation highlights the lack of access to basic health care, including water, sanitation, and rehydration fluids. Most cases of cholera can be treated with rehydration therapy. To reduce the risk of cholera in Cameroon in October 2021, the Central African nation vaccinated hundreds and thousands of its citizens against the waterborne disease. Also, the projects were started to improve the supply of fresh water and sanitation facilities. A donation of 800,000 vaccines from the World Health Organization enabled Cameroon to launch a nationwide campaign against cholera outbreaks. Authorities in Cameroon say that the lives of thousands of citizens are in danger. The state minister of health said in a press release published on Wednesday of this week that 5 of the country's 10 regions are experiencing cholera outbreaks, and concern that the cholera can spread not only throughout Cameroon but across the border to nearby Nigeria is very real. Cholera first was identified in the United States around 1817. At that time, physicians began to realize that there was a pathogen, bacteria, that was associated with cholera. Waterborne diseases, whereby water is consumed that is infected with a bacteria known as Vibrio cholera, was found to be increasing and becoming more in the 1800s as the population of the nation spread west. Water was often contaminated by settlers and by individuals moving to the west in order to find their fortune and to start families. Unfortunately, natural water supplies would often become contaminated, and drinking of these water supplies start the disease cholera. Today, it's very rare for Americans to experience cholera because of rapid freshwater facilities are widely available throughout most of the United States, and sanitation facilities are also widely available in most homes individually as well as throughout the community. What is cholera? Cholera is an acute diarrhea illness caused by infection of the intestine by the bacteria Vibrio cholera. An estimated 2.9 million cases and over 95,000 deaths occur each year around the world from cholera. Cholera typically leads to severe symptoms such as diarrhea, vomiting, leg cramps, muscle pains in 1 in 10 people who get infected. Loss of body fluids leads to dehydration and shock. Without treatment, death can occur within hours. How do you contact cholera? Cholera is usually contracted drinking water or eating food that is contaminated with Vibrio cholera and other cholera-type bacteria. A common source of contamination and an epidemic breakout in Cameroon at this time is usually caused by feces of infected individuals contaminating food and water supplies in areas where there's poor sewage and drinking water treatment. The disease can spread rapidly throughout a community. A casual contact with an infected person usually will not cause cholera, but instead, cholera is typically experienced by consuming food that's infected and or drinking water that has been infected. In the event that you or anyone you know develops diarrhea that is unexplained, you must seek medical attention immediately. This is a treatable problem, and the treatment is to replace the fluid that is being lost. The water, the salts, the electrolytes that are being lost in the diarrhea must immediately be replaced. A preparation known as oral rehydration solution is widely available commercially in America, Canada, and other nations, but also can be prepared in virtually any environment. Oral rehydration solution can be made by putting salt, sugar together with a liter of water and can be made in virtually any environment in the world. The recipe can be found for your community, usually online through your local healthcare workers. Most cases of cholera can be successfully treated and the patient's life saved. The purpose of the oral rehydration solution is to stabilize the patient, reverse the appointment with death, and reestablish life through adequate hydration. If you or anyone contact a mysterious known or unknown diarrheal disease, it is important to start treatment immediately and to seek medical attention. I'm your host, Dr. Terrence Baker, Doctors in the House, NABN TV.